Bismillahirrahmanirrahim. Today we are going to start mammary gland. The mammary gland is a modified accessory gland, or it is we are called as specialized accessory gland. So the mammary gland is not anatomically part of the upper limb. However, as they are situated in the pectoral region and their blood supply and lymphatic drainage are largely related to the armpit, so we study it during studying the upper limb. We are going to study mammary gland in by dividing it into 8 subdivisions, into 8 points. First of all, we discuss the introduction about the mammary gland, the situation of mammary gland in our body, the extent of its base, the vertical extent and the horizontal extent, and then the deep relations. The mammary gland is related deeply to which structures? The structure of the mammary gland, its skin, its stroma and parenchyma, then the blood supply of the mammary gland, the nerve supply and the lymphatic drainage of this gland. First of all, we will start with the introduction of mammary glands. The mammary glands are modified sweat glands. They are present in the superficial fascia. So they are the contents of the superficial fascia. It is hemispherical in shape. It is, as is told, that it is present in the superficial fascia. The breast is found in both the sexes, but it is rudimentary in the male. It is well developed in the females after puberty. So they are situated in the pectoral region. They are present in both sexes, but in the males and immature females, the nipples are small and surrounded by a colored area of the skin called the areola. So now we will discuss about the situation of the mammary gland. About the situation of the mammary gland, they are present in the superficial fascia. The mammary glands are divided into 4 quadrants. If we consider the mammary gland as its hemispherical shape, so they are divided into 4 quadrants. The upper medial quadrant, the lower medial quadrant, the upper lateral quadrant and the lower lateral quadrant. The upper lateral quadrant has a small extension of the upper lateral quadrant. This is called the axillary tail of Spence. It passes through an opening into the deep fascia. So this opening is called as foramen of Langer. The base of the mammary gland extends vertically from the second rib to the 6th rib, and if we consider the horizontal extension, horizontally it extends from the lateral border of the sternum to the mid-axillary line. The deep surface of the breast is related to the following structure. First of all, it lies above the deep fascia. The deep fascia is also called as the pectoral fascia. Means it covers the pectoralis major muscle. So the mammary gland or breast lies above the deep fascia or pectoral fascia. Secondly, it is deeply related to the 3 muscles of pectoral region. These 3 muscles are present beneath the mammary gland. First of all, the pec major muscle, the serratus anterior muscle and external oblique muscle of the abdomen. These 3 muscles are present deeper to the mammary gland. Then there is a space present beneath the mammary gland. This is called retromammary space. The retromammary space separates the mammary gland from the pectoralis major muscle. The retromammary space contains the loose areolar tissue. Because of the presence of these loose tissues, the normal breast can move freely over the pectoralis major muscle. It can move freely from side to side and above downward. Secondly, this retromammary space is a site for the breast implants. So we will discuss about the structure of the breast and blood supply, nerve supply, lymphatic drainage of breast in our next video.